Hello, this is Dr. Whiting, and today I want to take a few minutes to talk to you about one of the number one crippling, debilitating conditions in our society, and that's arthritis. Now, there are many forms of arthritis, and today we're going to restrict our discussion to what is often referred to as osteoinflammatory or arthritis. In other words, common everyday arthritis. The most common, the most popular, the most often occurring. This is where the joints inflame, there's a restriction of motion, there's pain. Eventually, over time, there can be disfigurement of the joints, especially of the hands, feet, knees, and so forth. Osteoarthritis can strike any joint in the body. And once you start to develop arthritis, you have it throughout your body. Yes, it may start in one place or another. For example, it may start in a hip, in a knee, in a shoulder, in the hands, but eventually it will spread throughout the body because it is a systemic imbalance of the internal chemistry of your body. Remember, you can't catch arthritis from even the closest of friends. So we're not talking about a bug. We're talking about a deterioration of the internal chemistry of your body. Now, if you look in the leading medical journals and in the Merck Manual of Medical Diagnosis, you will find that there is no official cause for common osteoarthritis. It has been associated with injuries, automobile accidents, sports injuries, etc. But that only accounts for a small fraction of the number of arthritic patients in the world. The vast majority of these people have seemingly no logical reason to develop arthritis, and yet millions of people, especially now as the population grows older in greater numbers, we're seeing more and more of this degenerative disease, which can rob you very rapidly of the quality of your life ahead. You work for years to retire, to be able to enjoy life, and then you're crippled with pain and lack of mobility and so forth. It's really terrible. And in many cases, in fact, most cases, it's not necessary. There's a great deal that we can do to help prevent the body from deteriorating in this fashion, even if you have been diagnosed with arthritis some time ago. I'm going to try to briefly describe to you what goes on chemically in the body when you develop arthritis. You see, between each one of the joints in your body, there is a soft material called cartilage. And every time you move that joint, perhaps thousands and thousands of times a day, with every step, with every hand motion, every time you raise your arm above your head, you are moving bone against cartilage and wearing away a minute amount of that cartilage tissue each time you do that. Now, that's not a problem as long as the body has the ability to repair and rebuild that cartilage tissue, keeping it fresh and spongy as an insulator between the two bones. The problem develops or begins to develop when your body cannot manufacture enough cartilage, cannot replace the cartilage tissue as fast as you wear it out. This tends to occur as we age. Now, the body needs a wide variety of proteins as well as other supportive substances to manufacture cartilage tissue. If those are not available in the diet, if you are having digestive problems and you're unable to digest protein foods properly, you can't break them down, then we're looking at a situation where your body may not, in fact, be able to absorb calcium nearly as well. It may not be able to absorb amino acids from proteins, and it may not be able to rebuild the cartilage tissue as fast as you're breaking it down. This creates an airspace between the joint. That airspace fills with synovial fluid, which is a highly pro-inflammatory substance. Over time, this causes irritation, inflammation, swelling, and further deterioration of the entire joint integrity. So the first thing we need to do when we approach arthritis is to provide the nutrients necessary to ensure that the body has the raw materials it needs to replace and rebuild cartilage tissue. We also need to ensure that the right substances are there to help maintain flexibility of the connective tissues of your joints. Those things include glucosamine, chondroitin, MSM or organic sulfur, cetyl myristoyate or CMO, stinging nettle, and a variety of other herbs. In the right combination, these substances can help the body to not only rebuild cartilage, but also to maintain flexibility of the connective tissues. The second thing we need to address is inflammation. Inflammation in and of itself is a good thing. It protects the body when it's injured. So, for example, when you sprain your ankle and it swells on 3 times the size, visualize that as sort of an insulation or a bandage. It hurts because you're not supposed to walk on it, and nature's trying to tell you to leave the thing alone and stay off of it so it can properly heal. The fact that most of us don't do that is another matter, but that was the original intention. So, inflammation in acute situations is very helpful. The inflammatory response in chemical situations is also necessary and very frequently helpful. However, when inflammation in the body runs rampant due to a variety of biochemical imbalances, that inflammation turns its ugly head and becomes a destroyer of healthy tissue and other chemical functions. So controlling chronic inflammation within the body is the second most important thing we need to do for those suffering from arthritis. Now, we can do this in a wide variety of ways. Here at the Institute, we have recently released an all-natural anti-inflammatory. It has no side effects whatsoever, and it can be taken at full dosage the rest of your life if you needed to, with no risk of stomach bleeding, ulcers, or other side effects. This formula, in the last few years, has revolutionized the way people manage arthritic and other conditions. Thousands and thousands of people are benefiting from this every day. And you can too. You can contact the Institute of Nutritional Science for more information about this and our other programs by calling 1-888-454-8464. You can also email us at askthedoc, ASKTHEDOC, at healthyinformation.com. Remember, the Institute of Nutritional Science is the cutting-edge leader on the internet for natural, progressive, alternative programs for managing a wide variety of chronic degenerative diseases. Our program for arthritis has worked for thousands, and it can help you too. But it can't help you if you don't follow it. So pick up the phone, get on your email, contact us. There's hope for you like for thousands and thousands of others.